Okay, now this sample collector has been rubbed top and bottom of the front and back of the teeth. It's been put into my mouth and completely saturated in saliva, and you'll see now if I just press it gently with my finger, it's squishy, it's soft, and I've saturated that with saliva. So the procedure to start this test running when you're ready to do so is simply to insert that into the base. And with this test, it isn't a screw procedure, it is a simple locking down and squeezing. And then I place that in an upright position to allow that saliva to flow out onto the aspects where those test strips are. And if we show you this now, you can already see the pink dye starting to flow up, some of them faster than others. Okay, and the alcohol test is going from a pale white to showing that it's saturated with saliva. It just changes tone slightly and goes darker. Key thing here is not to do anything now. Start your timer, and you want to come back and have a look at the results. They're showing it between 5 and 10 minutes from when you started that test to run. So we're now going to stop the video and come back in part 4 just to show you those test results and how to interpret the results of these 12 drug screens.